disaster relief, lifestyle wellness for care providers. So today's objectives, again, we're going to talk about the importance about disaster relief and some of the definitions. We're going to go over compassion fatigue and compassion satisfaction. And then we're going to talk mostly about ways to identify and practice that self-care. And I'm just going to be really curious to hear from you guys during that time about some things that maybe you're doing as well. So when we think of disasters and disaster relief, in the past, FEMA would usually think of creating the CCP in an area that has had a disaster. When we think of those, we typically think of natural disasters such as a tornado, a flood, a forest fire, that type of thing. COVID-19 is obviously a very unprecedented type of disaster, and it impacts everybody. So what's really great about what FEMA did is they allowed for CCPs to be in any area that was affected, and we know that that's in any state. So a disaster would be a sudden event, such as an accident or a natural catastrophe, like we talked about. This does link in with trauma. So we also know that trauma is any incident that is experienced or witnessed or perceived by that person to be traumatic. So those things could be one and of the same. Disaster relief is usually financial or physical help provided to people in areas hit by a disaster. And then FEMA is that Federal Emergency Management Agency. And FEMA is who brings about what we call that CCP, which is the Crisis Counseling Assistance and Training Program. So the CCP, different from thinking of like traditional mental health counselor role, it is more in the sense of outreaching and guiding for more of like a psychoeducation versus actual therapeutic based skills. So you can see here that the CCP is received after the Presidential Major Disaster Declaration, and it is for any state, tribal, or territorial government. So this program, this CCP for COVID-19, is also available for tribal and territorial governments. So just know that when you hear about that. And right now, it is, again, for anybody impacted by COVID-19, so that would include even us. And what we have the ability to do and kind of provide is different resources for all sorts of different groups. So it's not just, when we think kind of programs that we implement here at Tri-County, we usually think of our clients, but this would be for anybody in the community. Again, like I said, kind of like ourselves or any other healthcare workers, teachers, and it could be clients as well. So one way to get connected is through the disaster distress helpline. It is a free helpline. It's also anonymous. So that means that even ourselves could take advantage of this helpline if we felt like we were in distress. They have both the 1-800 number and then the text number. And because the program is new, we are also working on ways to get this connected with our current CommCare, like local line, but that's still in the works, so just know that. But right now it is answered by the National Disaster Line. Okay, so we're gonna just quickly talk about COVID-19 and maybe the type of trauma that we have felt by that. And then again, like I said, we'll jump really right into that compassion, satisfaction, and fatigue. So when we talk about trauma, we talk about different types of events. We could have a private event, a public event, and a community event. And as I talk about these, I would love for you guys just to take a minute in the chat box and type about what kind of trauma you think COVID-19 has brought about. So private trauma is usually something that we experience within ourselves. It's usually something that feels very isolating. It's usually something that has happened to just us. There can be public traumas. These are things that usually happen that are without our control. So they are things that just come about and happen to us. Usually there's not judgment within that public trauma because again, it's not something that can be controlled, but it can feel isolating. We can still have that hopeless feelings. And then we also can have the community trauma. And the community trauma is even greater than that public because it goes beyond just what was like impacted. So like a public trauma could be like maybe where an apartment fire occurred, but a community trauma would be like a whole block or a continual greater span of trauma in the community. So what do you guys think COVID-19 has brought about when we think of trauma? Do you think of it as a private, a public, or a community event? I'm just going to give you just a couple seconds to kind of. Vicki has public. Adriana has all three. Abby has all three. Christy also says, I think all three. Yes. So this is a little bit of a trick question where we are, yes, it is all three. So really we are able to experience this in all sorts of different ways. People who have actually come down with COVID-19 could be having a private event. We're feeling it within our public systems. And then of course, we're also feeling it within our community systems as well. Excellent. Okay. So we're going to kind of move right into that compassion satisfaction and compassion fatigue. So compassion satisfaction is where we have positive aspects of being a helping professional. And then we can have that compassion fatigue where we have the negative aspects of being a helping professional. Usually we think of those words burnout or traumatic stress or secondary traumatic stress. I think what's important to note is we can kind of bounce back between these two. When we talk about kind of resiliency and self-care, that's really where we're going to bring back up that compassion satisfaction. But the compassion fatigue is where we kind of want to focus on today and just think about like, where are we in the continuum of compassion fatigue? So this is a really cool kind of diagram and breakdown that came out of the University of Tennessee. And it talks a little bit about the phases of compassion fatigue. And I myself have definitely felt all of these in the last 19 weeks. I think we're going on having some sort of place or having the impact of COVID-19. So we could be any of these throughout the day, maybe even changing from time to time, from minute to minute. So the first one is feeling that zealot phase. At first I was like, but this is what we want to do. And then I'm like, oh, but I do see in times where maybe we're starting to have burnout that then we go above and beyond. And so I really liked the way that kind of broke it down. So we can have that zealot phase where maybe we're committed, we can have altruistic thinking, we're willing to actually do more work because we really want to make that difference. So before we get burned out, we're like, I'm sure I'm going to make that difference. And I'm going to do more work than what I actually can do. And that can spiral down that compassion fatigue. We can start to have irritability. This could be with coworkers. This could be with clients. This could be at home. So when we start to feel like maybe that client is no longer somebody that we are able to work with without feeling irritated, talking about delegating some of those things, figuring out where that irritability might be coming from. We start maybe cutting corners or having inappropriate humor. You can maybe start to feel the feelings of withdrawal. So this one I think is probably the bigger one for me because I'm somebody who likes to go home and put on my sweats and read a book and shut the door. So I have to remember to tend to my family and friends as well and stay in that positive place. And then we can also have that zombie feeling. And this is another one, the zealot and the zombie were the two that I felt like was a different way of looking at compassion fatigue and thinking like, oh yeah, these may be some places that I'm in. So when we're starting to have that zombie feeling, we could be hopeless, we could have rage, we might despise or loathe certain people or others, and we start to become apathetic and we just start to maybe go through the motions sometimes. So this diagram isn't perfect because really you would look at kind of the arrows as crisscrossing as well because you could kind of go in and out any of these. But really when we kind of go through these, we either mature or we leave the work. So I really like the way that they put that because I really like the strength-based feeling of like, when I'm fatigued, I can mature out of this. That makes me feel a little bit better, and a reframe of thinking of that, of what can I learn from this and kind of move forward my compassion fatigue. So you can kind of see there again, the diagram, and like I said, it could be interconnected or revolving. Okay. So we're going to go through just some of the symptoms of stress that we may be feeling. As I go through these different slides, if you think of other things that you have been feeling, definitely feel free to shout them out as well. So when we're talking about that compassion fatigue and that secondary stress that we start to feel, we can start to have headaches, maybe aches and pains. We feel that tiredness, itchy skin. I think the last one is terrifying, having frequent colds or infections, because we already are terrified of any little cough. So just being on the know about that, that if you are feeling overly stressed, your immune system may not be working as up to par. And so just allowing yourself those breaks and giving yourself ways to feel like your physical body is not as drained. You can have emotional symptoms of stress. Things like anxiety, inability to focus, irritability, being hypervigilant. I will tell you that being here in the office a couple days a week, my emotional stress and hypervigilance is a little bit high. I'm used to there being lots of people here, and now when somebody comes around the corner, I'm like, who is that and what is happening? Because we're just not used to that. I'm used to just being in my house now. And so thinking about those hypervigilance and things that maybe we would not be aware of. Symptoms of hopelessness, depression, and suicidality. I really want to stress the importance that even healthcare workers and professionals working in a mental health field, there are still coworkers who will struggle with suicidal ideations, and we really want to make sure that you as staff know that we are here for you, that we are open to talking with you about finding ways for you to make sure that you are healing and that you're getting the proper care that you need if you're having those thoughts, because we're in a very hopeless time. So I just want to make sure that people know that we are here for you if you are needing any special help there. So we might have relational symptoms. This is one that I think probably COVID-19 has impacted in ways. One, because we are much more with the people that we live with more often, but also trying to figure out how to navigate maybe multiple people working at home, maybe our children being at home more often than not. I love my kiddo to death, but I certainly was not prepared for what an entire day was like. 7 days a week, now going on 20 weeks. So I was not prepared for that. And what a difference. School, being able to be out with loved ones, those types of things make a difference. So really thinking about ways that maybe your stress level has impacted those relationships could be a different place that you're thinking about now. Ways that we can make sure that we are having a changing of perspective and attitude, and that we're really trying to connect with those around us. We may be having some occupational symptoms of stress, feeling like we're late or absent. The quality of work may not be as high, frequent mistakes. We could be unable to track or remember, having emotional outbursts, maybe more complaints or grievances than normal. So thinking about those things, maybe thinking about how can you break up your workload so it doesn't feel so overwhelming, and that you're also able to double check your work if you're needing to, or even having somebody else double check your work. So if you're feeling stressed in this time and you really want somebody to go back and maybe approve your notes for a week or something, talk to your supervisor about those things just to help yourself keep on track. We could be having intellectual stress. This was also a new one for me. When I was coming to work every day, I would listen to a book on, we call them book on tapes. I don't know what they're called now. Audiobooks, that's it. I'm like, that's an old term, book on tape. Audiobooks. And I got out of the habit of that. And it was actually really hard for me to get back into reading a good book. And that was something that I was not used to. I just could not focus on just sitting down and being able to read. So this was one that I really had to look within myself, figure out ways to kind of bring up that self-care. So we could be resistant to learning new things. We might have and unwillingness. We might have that loss of self-awareness, and then again, those reading and writing problems. So kind of along with occupational, but this could be more on the organizational level. And this is where I really feel like we have to give ourselves grace, because we really have no idea what we're kind of looking forward to on a week-to-week basis, even within our organization. We just don't know what's going to continue to happen. And that is of no fault of our own. We have to continue to go by the guides of the state and those types of things, and that's changing daily as well. So we could be having that organizational stress just due to, again, the unprecedented nature and the unknown. So we could have some fragmented teams or some gaps in service. We might have interpersonal conflict. We could have waste of resources, maybe ethical problems, and possible problems with recruitment and retention problems. So just thinking about ways that we can think about those and be ahead of those organizational stressors as they come about during this time. Okay, so after we have now discussed all those stressors, we can take a big deep breath, because that was stressful for me to even read through, because I want to think about the good stuff. So we want to talk about how are we going to be able to build that wellness within ourselves and those protective factors against trauma. So first and foremost, I would love for you guys to just put a little bit in the chat box about ways that you have been resilient during this time, or even ways that you have seen resiliency within the community. It doesn't have to just be personal. You could put throughout. And just a reminder that resiliency, I like to call it your bounce back ability, but that's your capacity to prepare for, cope, and grow through adversity. And I'm going to give you guys just a couple seconds to think about that resiliency and think about maybe some ways that you guys have prepared or coped or had to grow through some things. All right. Lori, do we have some things in the chat?
We do. Time with dogs and family. Yeah. I've started in a couple of new hobbies. Time for walking, meditation, and prayer, keeping up with friends. More energy, being more physically active when at home. Learned how to talk on the phone.
Oh, that's
be creative with time alone. Exercise. Removing social media from my phone, taking lots of walks, and working out. I really like the social media idea. I think that that level of input has been really hard.
Yeah.
Learned some new skills, becoming a kindergarten teacher.
Whoa, excellent.
Daily workout program for the morning and a yoga program in the evening. I love the both.
Yeah.
Exercising and looking into meditation and not watching the news. So it seems like a lot of people are protecting themselves from the constant input. I think in our jobs, it's really hard to be inundated day and night with that input. I spend like 2 minutes on CNN and the Clay County Health Department's website once a day, and that's it. Everything else is just noise. Tom sends important updates. CLT sends important updates. I feel like I'm able to keep up without any news.
Yeah. I love those. You guys are doing, yes, like Lori said, lots of protective factors. That makes me feel really good about what our staff is doing. That's excellent. Wonderful. All right. So we know, again, stress is normal, but the known is better than the unknown. So more of those things that we can do that are of the known, like creating a schedule and having that predictability, definitely helps us manage stress. It sounds like you guys are doing some really great things as well. So some other things on how to mitigate and prevent stress here in the workplace, we'll talk about those a little bit first, is having those clear expectations and processes. And this is where I think we have, as an agency, done a really good job, not only trying to get out what we're doing as quickly as we can, but also recognizing that we have to have new processes, new expectations in place, lots of grace that we have to have with staff, because things are changing weekly sometimes. And so that could even be daily. So just really making sure that we're having those clear expectations and processes. Our management teams being available, and also making sure that you're reaching out to your supervisor if you need, having clear emergency protocols, having regular and productive meetings. I have really appreciated having team meetings. This is actually not something my team was really able to do a lot when we were in the building, because half of my team works in the field most of the time when we were in 10 different places doing 10 different things. And now we all have a little chance to just get together on Friday afternoons and kind of end our week on a high note, just talking about some about work, but some it's just about what we enjoy. And so that's been a really great place to enjoy having different types of meetings that maybe we weren't able to have in the past. Having predictable schedules and breaks, so remembering that you still have to take a lunch break away from the computer if you can. I am lucky enough that I usually have a 7-year-old that I'm eating lunch with, so I have to make her something, and that takes me away. Otherwise, I probably would be in front of the computer. So just really trying to remember to still have those at least 2 15-minute breaks, having that scheduled lunch, taking those walks still throughout the day, and breaking away from that computer for sure a little bit. And then that practice and self-care, you guys said a lot of these. So again, I feel really proud that our staff is taking care of themselves, but you may find something in this list or something in the chat that was something that you had not thought about, but making sure you're keeping that movement in mind, your mindfulness, making sure that you're having brain breaks, making sure that you're having some downtime, maybe doing something different for that downtime, doing something new. I have picked up more coloring than I probably did beforehand, because it's something that I can take a break and come back to, and go back, take a break and come back to. Puzzles have also been a good one at our house. Again, something that we can kind of work on and then come back to. And so that's been something for us that has really worked. And Lori mentioned this one about the news, but absolutely taking good breaks from the news. This says 20 minutes in the morning and 20 minutes in the evening. I'm not sure I'm even doing 20 minutes right now. I also am doing more of research on the health department websites, just trying to get updates versus listening to actual news stories, but doing more of just looking at the websites and trying to get those updates. And then also making sure that we're staying emotionally close while also physically distancing. So still taking care of ourselves in that way with the physical distancing, but also making sure that we can, connect with our loved ones and connect with those people who maybe we're not able to stay as close with. And then if we have to, proactively changing our patterns. So if we're finding things are not working, if we are getting more sidetracked than normal, if we're feeling distracted, thinking about how to change that up. Do we need to change up our workspace? What does that kind of look like? So thinking about just some of those things. All right. So we are going to wrap up here. And I really just want to know if you guys have any last thoughts, any questions in general about the crisis counseling program or the CCP. We also call our crisis counseling program here in Missouri, it's called Show Me Hope Missouri. So you'll also see the Show Me Hope logo a lot, and that is for the crisis counseling program. And then again, you can see here just our disaster distress hotline, and then that first steps line, and then you guys know our main number as well. But I will open it up. You can unmute yourself, or you can type in the chat box. Just open it up for questions or last thoughts.
Candice, I think it might be helpful if we talk a little bit about how we're going to utilize our crisis counseling program. So as our teammates hear about it and they can share it with their needs in the community.
Yeah.
And I'm happy to do that. So
Yeah,
we have several people who are currently working with the.
Ooh. Sorry, Lori, I think. Okay, you're back.
You guys hear me?
Like you got muted.
Okay. Oh, I think you muted me when you muted yourself. So we have a team who's worked together to try to develop our own little side shoots of this, and what we're pull together the information that's coming from FEMA and from across the state. So we have a lot of support. We've spent the last 6 or 8 weeks organizing and thinking about who would be important to do outreach to. So we have specialists working with our older adult population, with our youth population, with our population of pretty severe mentally ill, chronic mental illness clientele, and then just across the community. And then we have our crisis counselors who are actually available to do some of the counseling work that goes along with this. It looks quite different than the work that we do at Tri-County. Our treatment programming it really is specific to COVID and how we can cope. So we're spending a lot of time developing different webinars and training opportunities and flyers and different ways to get the information out to people, because not only is it resources about how to manage your mental health symptoms, this is of course what we're best at, but it is also a lot of resources that are available to people for other needs. So food, housing, shelter, things that just basic needs as well. So I think as the months go on, it'll be interesting to watch and see how Tri-County adapts to this program, but feel free to share this with everybody that you work with in the community. We have some basic flyers that are great to send out to your partners. This is available to anybody, including ourselves. So feel free to share it with professionals as well as our consumers. Candis, if you have other thoughts, go right ahead.
Yeah, thank you, Lori. Yes, absolutely. Lori hit it right on. So we do have some different special populations that we are going to try and reach, but this is certainly available for everybody. So if you know of a group, an organization, anybody who maybe could use a training, who could use a mental health first aid class, who could use just a peer support group. So if you know somebody who's wanting to have a peer support group set up, but they don't have a facilitator for that, they could reach out to us and we could set up a support group for them just to come together and be able to have that. So there's lots of different ways that we're able to use our resources. And like Lori said, this is special because it can be for anybody. So it can be to any of our community partners. And I can send out the general flyer to everybody. We'll make sure that we get that out to everybody. And then of course you can reach out to the CCP team. We actually have a CCP email, so you can just type in CCP at tri-county.mhs.org. And you can email our team and we can send you different resources, or if you have requests for trainings or networkings, we can make sure that we get connected with our community partners as well. And we will have a YouTube page starting, so that'll be exciting and coming up and really fun. And then you will also see quite a bit of media on our Tri-County website and Facebook page as well that will have the Show Me Hope Missouri kind of embedded information in there as well. All right. Well, thank you guys so very much for participating. We truly appreciate you being here and joining. And again, if you have any questions, certainly feel free to reach out. And Lori, do you have any last words?
No, it's just nice to see everybody. Thank you for being here. I think collaborating and talking through some of this stuff, it has its own level of benefit. So just a reminder, reach out to those that you care about, even if you don't see them on the regular. It's been fun to see the way people are connecting during the time, though. Make sure you make those regular efforts. I think that's a lot of the resilience we need to build. So share this information. We're ready to provide what we can, open to ideas as well. So if you think of things that would be beneficial to anybody that you work with, that you know, please send them our way. We're creating this as we go, and it's been pretty cool to see across the state the things that have come up, different resources and ways to collaborate and communicate. So we would like to welcome you to bring us ideas as well. I hope you guys all have a great day.
Yep. Have a wonderful day and a great week, everyone.